A man dismisses weeks of nagging fatigue and muscle cramps as normal exhaustion from a new workout routine. Until one night, he notices his urine has turned the color of cola. That single detail sends him to the ER, where doctors diagnose rhabdomyolysis, a dangerous breakdown of muscle tissue. Nobody warned him that his own toilet bowl had been sending him warning signals for days. Urine isn't just waste, it's essentially a live readout of what's happening inside your kidneys, your hydration status, and in some cases far more serious conditions hiding beneath the surface. Here's what each shift in color is actually telling you, and when it's worth paying attention. Urine is produced when your kidneys filter your blood, and its color largely reflects two things: how much fluid is in your bloodstream and how much filtering work your kidneys are doing at any given moment. There's no single, perfect shade. But healthy urine generally falls somewhere on the yellow spectrum, colored by a compound called urobilin, a byproduct created when your body breaks down old red blood cells. The more water you drink, the more diluted that pigment becomes, which is why very clear urine usually signals strong hydration, and pale straw yellow is generally considered close to ideal. Fully colorless urine after heavy water, caffeine, or alcohol intake isn't necessarily concerning, since all three increase urine output. Though if it happens constantly, it's worth easing off fluid intake slightly. Dark yellow, amber, or honey-colored urine typically signals inadequate hydration. When the body senses a fluid shortage, the kidneys pull water back into the bloodstream rather than releasing it into urine, concentrating the remaining electrolytes and proteins, and that concentration is what visibly darkens the color. Other signs of dehydration worth watching for include fatigue, chills, bad breath, sugar cravings, and muscle cramps. General guidance is roughly 1.5 to 2 liters of water daily beyond other fluids. If darker urine persists despite adequate intake, it's worth having a doctor take a closer look. Certain medications can also produce this tint as a side effect. Phenazopyridine, used for UTI-related pain, and sulfasalazine, used for ulcerative colitis, are common examples. Dark brown urine, resembling black tea, brown ale, or cola, sometimes has a straightforward dietary explanation. Rhubarb, fava beans, and aloe can all produce a distinct brownish tint without anything being wrong. But brown urine can also indicate a significantly more advanced stage of dehydration than dark yellow, severe enough to potentially strain kidney function and stress other organs. It can also result from a recent urologic procedure, as blood slowly dissolves into the urine, or from certain antibiotics and laxatives. More seriously, dark brown urine can signal rhabdomyolysis, the muscle breakdown mentioned earlier, often accompanied by cramping, severe pain, and unusual weakness after an injury or intense exercise. It can also point to impaired liver function, where excess bilirubin, a byproduct of bile, gets processed through urine instead of its normal pathway. For anyone with a history of melanoma, persistent brown-tinged urine is worth mentioning to a doctor, as it can occasionally signal disease progression. Regularly occurring dark brown urine, not a one-off after a hard workout, warrants proper medical evaluation. Pink or red urine can result from something as simple as blueberries, beets, or rhubarb in a recent meal, or from certain medications. The antibiotic rifampin is a well-documented example, known for turning urine a distinct reddish hue. But if there's no dietary or medication explanation available, a pink or reddish tint may indicate blood present in the urine, which should prompt a visit to a doctor to rule out a UTI, kidney stones, or another underlying condition affecting the urinary tract. It's worth keeping in mind that visible blood noticed in the toilet bowl can sometimes originate from elsewhere entirely and be unrelated to the urine itself, so context matters here. The color that more clearly signals something requiring real investigation is a darker, burgundy or deep red tone, closer to red wine, more reliably linked to blood that needs proper medical evaluation. Blue or green urine understandably looks alarming the first time someone sees it, but it usually has a fairly benign explanation. Certain food dyes can cause it, and asparagus is a classic natural culprit. alongside its well-known effect on urine odor. A range of medications, from heartburn treatments to certain muscle relaxants, can also shift urine toward blue or green tones as a known side effect. Less commonly, certain fungal or yeast infections, or a specific bacteria called Pseudomonas, can cause a greenish tint in urine, usually accompanied by other clear signs of infection like burning sensation, pain, or fever, rather than appearing as an isolated symptom on its own. Rarely, blue or green urine has also been linked to a genetic condition affecting calcium regulation in the body, though this is uncommon enough that it's far from the first explanation worth considering. The broader takeaway across all of this: normal day-to-day variation in shades lighter in the morning after a full night without fluids, darker after a workout, clearer after a big glass of water, is completely normal and not something to worry about. Searching symptoms online in isolation tends to create unnecessary alarm rather than useful clarity, since color alone rarely tells the full story without other context. But if a color change is persistent rather than a one-time occurrence, unexplained by anything you've recently eaten or any medication you're taking, or accompanied by other symptoms like pain, fever, or unusual fatigue, it's worth having a healthcare provider take a proper look before flushing it away and moving on with your day.